Join us as we explore evidence-based practice, manual medicine, and sports science through the lens of movement, strength, performance, and overall health.
Welcome to the Strength and Chiro Podcast. My co-host, Dr. Stephen Redmond, but I like to call him Redmond, or I like to call him the Tony Stark of chiropractic. We've got a couple of guests. I'm really excited to have these two guys on, actually. It is my pleasure to introduce our first guest, Coach Bryn Ealey. Bryn is a strength and conditioning coach. He's a mental performance and corporate coach here in Aotearoa, New Zealand, and he has plenty of brains to match up with his massive biceps brawn. Bryn's best lifts are 290 squat, 180 bench, and a massive 300 deadlift. Very impressive. Bryn holds a Bachelor of Applied Science in Sports and Exercise and has quickly become an expert in his field, coaching national and Olympic level athletes with a background of rugby, strength and conditioning professionally. As a two-time powerlifting national champion and former national record holder, Bryn has a strong ethos based around human movement and optimizing performance. And he has the experience and the knowledge to back that up. Over the years, Bryn has worked with athletes from multiple disciplines, which include combat sports, powerlifting, rugby, bodybuilding, Irish dancing, ultimate frisbee, football, and trap shooting. He is a good friend, and we have shared the platform many times, the powerlifting platform that is. I respect his work ethic, and I respect how he conducts himself as a professional, an athlete, and a coach. He is one of, if not the leading strength and conditioning coach in the country, and I know he will bring a ton of value to this podcast. So welcome to the podcast, Bryn.
Thanks, Brogan.
Next up, introducing our second guest, student doctor of chiropractic, Luke Gichard. Luke has a diploma in applied science and is currently studying at the New Zealand College of Chiropractic. Luke is no stranger to movement, sports, and performance. Throughout his schooling years, he played rugby, cricket, and was heavily involved in athletics and running. Luke, along the way, has played rugby for the Hawke's Bay Rep team, Auckland Varsity Sevens Open Grade, Hawke's Bay Cricket Reps team, and travelled to compete nationally in athletics. Luke found the gym at 15 and fell in love with strength training. Luke is an incredibly intelligent, straight-A student and one of the hardest workers I have ever met. He is an out-of-the-box thinker and has a unique ability to critically think where others cannot. He's a fantastic chiropractic intern, and I call it now, he will be the best chiropractor in the country. We welcome the LGC, the Luke Gichard, that is one word, the long of NZCC, Luke Gichard.
Cheers, bro. Thanks for having me on.
What an intro. What an intro. We've been kind of promoting this for the last few weeks. So I think people are ready for some information. And me and Stephen, obviously, really excited to have you guys on. This is our 5th episode now. And we've been having really good feedback. This has been kind of stimulating a lot of really good conversations on and off the air. So not just what we've been doing in the podcast, but on Instagram and Facebook, through friends and stuff like that. I suppose the point of what we're doing is not just to do a podcast, but to kind of stimulate some thought and to get people really thinking about some of these nuances when it comes to performance, strength training, and also clinical stuff as well when it comes to chiropractic, physical medicine, manual medicine. And we really want to try and elevate as much high quality information as we can. And occasionally we like to challenge some of the bagged information too. So a little bit of drama goes a long way with the views.
I interrupt this podcast to thank Raisies for sponsoring the Strength and Chiro Podcast. Raisies is a family-owned New Zealand business that only produces high-quality, all-natural and clean products. If you're anything like me and you need a protein that tastes good, mixes well and contains no additives or nasty preservatives, this is for you. This protein is New Zealand-made, ultra-filtered, gluten and GMO-free with no artificial flavors or colorings. If you are an athlete or you love to train hard, it is essential that you get an adequate amount of protein. We would like to thank Raisies once again for sponsoring the podcast. You can get 10% off at raisies.co.nz.
So first one's for you, Bryn. I really just wanted to jump into the importance of exercise and strength training. This is something that I've been talking about quite recently on my channel when I've been putting out some posts around strength being medicine or strength training being medicine. We fully understand how important it is to exercise, us four sitting on this podcast. But what about the people that are listening? I'd love for you just to explain a little bit around why you believe it's so important that people are moving, why you believe it's important that people are strength training, and give a little bit of an insight around that.
So for some of the people that I work with who are general population who don't necessarily have the desire to compete, a lot of the training and the movement that I do is obviously very strength heavy.
Yeah.
And before I train anyone, we go through a basic movement screen. So I see how they're moving currently without any strength training. And we look for deficiencies or imbalances within the muscle that are currently causing a dysfunction or pain within their day-to-day life, right? So for someone who is not strength training, their daily habits will dictate a lot of their posture and their movement patterns. So whether or not it's someone who's sitting at a desk all day or someone who is carrying stuff for a job, you'll start to see some weak links within the chain based on a bias or a movement bias they have in the position that they're in for 35 to 40 hours a week, if that makes sense.
Yeah.
So when they go see someone like yourself, Stephen, or a chiropractor, and they think that, okay, a chiropractor is going to give me an SI joint adjustment or a thoracic adjustment, and that's going to fix everything. To a degree, adjustment is a massive help, yes, but by strengthening areas, it allows people to maintain that right posture for them every day, all day long, if that kind of makes sense.
Yeah. Yeah, and how important is it for clinicians to have strength coaches and strength coaches to have clinicians? And that's the thing. Sometimes when you get into industries that can be similar, you can get people trying to compete. But for me, like, I'm always trying to think about people I can refer people to, because especially being in New Zealand, like, it's like it's a small industry in Aotearoa. It's,
for sure.
you know, so for me to, like, if a family member comes to me and says, I want to see a chiro, like, it's a hard question to answer. And similarly, if someone comes to me and asks me, I want to see a strength coach, that's a hard answer to answer, and it shouldn't be. But I love having people I love referring people to other professionals. But those two need each other, because, you know, the average person, like you said, general population, the average person's seeing you more than they're seeing their GP. The average person's seeing their PT, their coach, their strength coach, their powerlifting coach, whatever, more than they're seeing their PT. Their GP. And then in a similar fashion, they're probably seeing their chiropractor a lot more as well. A lot of many average people don't get into their GP's office that often at all. And so that's why it's so important that we have that first line of healthcare is important. I like what you spoke about when you talked about posture. I like what you spoke about when you talked about strength, and the importance of that, especially when it comes to what people are doing day to day. People can't have posture 40 hours a day and then expect to unwind that with 10 minutes of foam rolling. Do you know what I'm saying? Yeah. It's important that they actually have, you know, a planned, periodized, structured program by someone who knows what they're doing. And so that you actually have that coach's eye and you can see, hey, what do we need to stabilize? What do we need to mobilize? What do we need to strengthen?
That's why, Brogan, I know you and I have spoken about it many times before, but that's why having an understanding of fundamental movement patterns and how someone should be moving according to their body is so important. Because typically what happens within the personal training realm, and I've been in the personal training industry coming up 8 years within New Zealand now, you'll have someone walk into a gym, they'll get assigned with a PT, and the PT will, most of the time, sit down with them, get their goals, and get them straight into a program without assessing or identifying any kind of structural balance. And that in itself is a bit of a nightmare, but it's the reality of our industry currently. And as you alluded to before, I have very strong ties with my own chiropractor, and we have a very good system where he'll refer clients to me if he feels like they need my help in terms of strength training, and I send people to him if I feel like they need his help in terms of alignment.
Yeah, exactly, because we know the physiological effect and biomechanical effects of an adjustment is great, but short term. That's the thing. It's good. It's fantastic. It can modulate your pain. It can help with multiple things, right? Especially with just that my international survey I did. We found that proprioception, range of motion, like there's multiple things that it can help with, but we kind of have an idea based on the literature that's all short term. And that's why we need, and you said something about pipe, like you're going to have a pipeline, you're going to have a plan for your clients. We need that pipeline from a chiropractor to a strength coach and from a strength coach back as well. We need that communication, right? Because we need to be able to have a pipeline for people to get better based on what is wrong. And we can't just get them on, okay, get on your back and bang, 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 give them the flying seven, crack, 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 and send them out the door without having any pipeline if they need that. And this we'll get to Luke in a second, but just a pit stop along the way. Stephen, I know for someone like yourself, you're not the average chiro. What I mean by that is you do implement strengthening exercise, rehab exercise. You don't just talk to your patient like there's some random person off the street. You actually educate them with movement, right? So you're not just like, oh, we'll get you to do some press ups. You actually say, hey, this is what I want you to do. This is abdominal bracing. This is how the pelvis moves. How do you approach making sure that your patients have enough to do outside of the office that they're going to get better? And do you find streamlining into some type of strength coaching PT professional is important?
I usually start them off with one or two exercises, and I'll build in exercises as we continue with care. Because if I overwhelm them with too much, they won't do anything at all. They may not even come back because they'll be like, that's not what I'm here for. So I'll start off with one or two things and implement one or two more things based off of how they're responding or if they're even doing what they're supposed to do. If they're not doing what they're supposed to do, then I just tell them they need to find like a trainer to take them through these things because they obviously don't have the self-discipline to do it at home, and that's okay.
Yep.
Some people can, some people can't. Some people have the equipment, some people don't have the equipment. So streamlining it down to someone who's able to coach them through everything is absolutely beneficial for a lot of the population.
Yeah, and that's that. I mean, we're just talking about general pop as well, like gym pop. That's not even considered, obviously, talking about athletes or high-level athletes or anything like that. The cool thing about exercise, regardless of if we're lifting weights, I know a lot of people watching this podcast might typecast some of us, especially, I suppose, me and Bryn being powerlifters. Sometimes we do get lumped in that box. I know sometimes when I've had clients in the past, they've said to me, oh, I've been to see my physio and she's told me no more powerlifting. And I'm like, what you're doing is fundamental movement. It's biomechanics. It's not powerlifting. But, sometimes people they'll typecast and they'll put us in a box. But really, it's not just about, the resistance training is important. But even if it's walking, right? Bipedal movement, even if it's just putting one foot in front of the other, like exercise, if there was ever to be a magic pill, right? If there was ever going to be a magic bullet, it's exercise, right? We know with all like the association with decrease in cardiovascular risk, all-cause mortality, different types of cancers, immune conditions. Like we know it increases physical function, cognitive ability, emotional regulation, different types of psychological problems. If there's ever going to be something that was going to have an impact on every part of your physiology, it's going to be exercise. And sometimes I find the on-ramp to exercise is daunting. And people think that especially looking at someone like myself or Bryn, being like a big powerlifter, that can be daunting. Like, oh, this person's telling me to exercise, or this person on Instagram is putting up all these posts like, oh, you've got to exercise. So over to you, Luke. How are some ways that you can make exercise to your patients? Because you're seeing patients you're a student doctor at the moment. You're seeing patients in the clinic. How is a way for you after you've done your adjustment, you've done your business, you've pleased the mentors, you've had your stuff signed off? How are some ways that you can make exercise more palatable for your patients so that they are going to go away and they are going to engage in it? Because our best tool as clinicians and coaches is, I know we get caught up in what we do with our hands. We get caught up with adjusting, or we get caught up with writing programming. But really the best thing we can do is education. If we can educate our patients and our clients on ways to move and encourage them, we can literally save lives. So that's a really powerful tool. So what are some ways you do that with your patients in the center, Luke?
Yeah, well, I'm sure you're aware of like the process we were going through. Obviously, there's the 2-hour new patient that we have to cover, thorough health history, orthopedic, neurological tests, all that good stuff. And then following that, we're going away, we're writing up the case report or narrative that we're discussing through with a mentor. But yourself, right? There are some setbacks and some holdbacks with the process. So it's sort of working around this. Obviously, we are allocated like a short period of time for that check and adjust kind of approach for the appointment. So I guess for my approach and my mindset with what I want to do once I graduate is, at this current time, unfortunately, I'm having to work around these appointments, basically checking in with my patients and clients or whatever outside of these appointments and seeing how we can push things forward through that. So that's a couple of the things that I look to do in my current situation now. But if we're covering on points of the importance of strength and exercise, like there's a lot of stuff that we can dive deep into here, but for me, like, I'm going to take it a different route. If we're looking at one of the most common chronic metabolic bone disease, such as osteoporosis, right? So we got stats showing right now, 1 in 5 men, 1 in 3 women over the age of about 50 will experience some type of osteoporotic fracture in their life, right? Whether it's falls, whatever.
Yeah.
So if we look outside of other risk factors to this kind of disease or condition, such as reduced calcium intake, vitamin D, smoking, that all plays a factor. But we literally have one of the most powerful lifestyle drugs with the absence of the harmful side effects, right? And that's what we're discussing right now is the strength training and exercise component. So incorporating that, like you touched on before, it's a very daunting process. But even if it's 10 minutes a day, like the importance of regular weight-bearing exercise for increasing bone density through these stages of life is so important to avoiding these future, conditions in the future. So the research is out there that, shows that movement is medicine, and it does have a direct impact on, the things you touched on before, increasing muscle mass, improving metabolism, reducing the risk of cardiovascular disease, diabetes, psychological conditions, all of that stuff. So it's surrounding yourself with the likes of yourself and Bryn, who have been doing this for years. You're athletes, you have positioned yourself under a bar with tremendous amounts of load, but you've also moved it well. And unfortunately, there's too many people out there currently that are getting sucked into these false claims and petty programs that have no science whatsoever behind it. So sort of the importance of that anyway.
Big time. The cool thing as well about what you're saying is, we were touching on it before in terms about like having a pipeline into long-term changes, which is our strength training, our rehab, our movement-based stuff. But there is also a couple of studies that have come out of the New Zealand College Research Department that do look at proprioception. I know like the adjustment to the cervical with elbow sense, position and proprioception. We've got one that they did on the elderly that looked at step reaction time, and that they had some really favorable results on that as well. And then also there was a study on feed-forward activation, so the activation of your core. And so again, I like a lot of these things are likely to be short-term, but man, they really do like go hand in hand and facilitate strength training and rehab and movement. They really do. And a little bit of a plug, but we have a case study coming out where we actually looked at how an MPI-styled CT adjustment impacted a person's proprioception awareness. And the participant was asked to stand in tandem on a gymnastic beam and stand as long as they could with their eyes closed. First attempt, couldn't stand at all, even for 1 second, eyes closed, standing in tandem, couldn't even stand up for a second. Hop down, cervicothoracic, CT junction adjustment on both sides, MPI style, and repeated the exercise. And the participants standed there in tandem, eyes shut for a complete 60 seconds until either researcher stopped them. So that's even cool. And obviously we need to look at, there's so many more studies to look at, duration and how long these are there these permanent effects, which are likely not. But it just goes to show that these really do facilitate that strength training and that rehab style of things. So, and a really good point about the osteoporosis type thing. I know that as people get older, one of the main causes of death is old people just kind of have falls. They stop moving, their bones get weak, bone density decreases, and they fall, and then they end up in the hospital, and they get pneumonia, and then it's kind of downhill from there. So staying strong and moving right to the very end is critical. We can literally talk all day on this, so we'll move on. So much good content already. Bryn, why does technique matter? And especially, why does technique matter under load?
So it's actually interesting we talk about this because I was having a chat with my soft tissue therapist this morning, as she's a client of mine. And it's one of those things, Brogan, where when we look at how someone moves without load, we all have to understand the fact that everyone has to move uniquely according to their body in terms of limb lengths and things like that. So, for example, someone who has short torso, longer limbs compared to someone with short limbs, long torso, one person from the different body type can't look at the other and say, oh, you have the wrong technique, because the way they move is they're moving how they should move according to their body makeup or their hip structure or things like that. So when it comes to the ideal technique matters according to the right person at the right time.
Yeah, and it's interesting because we can look at it through a lens of powerlifting, but when you're dealing with the general population, telling someone who, maybe doesn't have the leverages, or the biomechanical advantage of being able to sit into a nice, easy squat, short femurs, long torso, like myself, asking someone like that to squat perfectly, like a weightlifter, like the perfect little squats you see where people just have the short little legs and they just go down into the squat. It's really unfair. I mean, it's like the old Lane Norton squat, like that type of leverage. Like when you watch Lane Norton squat, like it's that tall person squat, like the full fold over. Yeah. It's that long femur, short torso folder. Asking someone that has those leverages to do a perfect looking squat is that's not technique in itself. Like you're saying, technique matters. It's contextual, right? For sure. It's not one size fits all. One time I was talking to a professional clinician, and he was like, "Oh, why do you guys?" He was talking about powerlifters and CrossFitters. Why do you guys exercise? Like you just hurt. Like I feel like you're paying most of your loan. Like you'll just hurt yourself. Like what's the point? Now I'm not going to sit here and defend CrossFit, but in terms of this research, powerlifting is actually very safe and low risk in terms of injury. But a question for you real quick, Stephen. Do you have many people coming and seeing you that have hit themselves from exercise and they're like a little bit frustrated? Like, oh, I was exercising, I did this. And then you kind of have to try and re-educate how they feel about exercise.
Yeah, it happens. But, I mean, thankfully they don't think they shouldn't exercise again. And if they do, I try to assure them they absolutely do need to exercise again. We just need to find out what they did that might have led to them getting injured while exercising. I think I told you about that baseball player I had a while back, right? That always had pain when he squatted. Yeah. And he's a baseball player. He needs to be able to squat. So we had to make him squat pain-free.
Yeah, and people come in and they see you, like we talked about in the last one, and they're saying, oh, I want to be able to, I'm not sure what this one was. Last episode we talked about it, and she was asking, I want to be able to do something. And you're like, okay, let's work on getting you to touch, I think it was touch your toes, right? I want to touch my toes. It's like, okay, let's work on touching your toes. But yeah, anyway, we'll get to all that kind of stuff. So that's exciting, really cool. Great answer, Bryn. Carrying on from that, specifically, I'd just love to hear your thoughts on particularly why you think, so we've talked about why technique is important and why it is specific and contextual to the person. There are, however, certain things that we do kind of have an idea are bad, right? Certain ways the body can move under load where you're going to have force leaks or biomechanically not efficient, or where you're putting too much pressure on passive structures or tissues, and if you overload those, exceed their capacity, you're going to have injury. When it comes to the scary lumbar flexion and knee valgus, what are your thoughts on that? And B, how do you How do you talk to your patients about those types of things when they may not understand all of the terminology and all of kind of the backstory behind them?
So if we look at lumbar flexion under load, it's one of those things that came into fashion. We'll use deadlifts as an example, right? So a lot of people who train the deadlift, or a lot of the gym culture, has been kind of surrounded by training muscles rather than training and mastering a movement. So the issue we've run into is people associate, okay, we'll do the deadlifts on back day. So instead of understanding the fact that it's a posterior chain exercise and it's a hinging movement, and everything we do within that movement, the shoulders should be stacked, everything should be biomechanically efficient. But a lot of people go, okay, it's a back exercise, so what I'll do is I have to initiate the movement with my back in order to feel it in that area. So the issue we run into is people will start initiating the movement with their lumbar spine. And when we look at the anatomy of the lumbar spine, it's not really efficient at tolerating high amounts of shear load within a localized area. It's relatively rigid. So in comparison, if we look at the opposite end, so if we look at the thoracic spine, and you'll have people who do round back deadlifts, there's a lot more flex or movement within that area, hence the ability to handle load better. And I will say better, I won't necessarily say efficiently, because when we look at thoracic rounding in terms of a deadlift, it's very hard to lock the movement out. And that's an issue you see with people with that style of deadlift. So when we go back to the lumbar spine, it's one of those areas where a lot of the back injuries that happen within the gym are due to the fact that that area is locally loaded by an amount of force that that person's body cannot handle. So we're only as strong as the weakest link. So if for example, deadlifting 180 to 200 kgs, and that's near the person's max, and they are constantly initiating the movement with their lumbar spine and going into flexion, I can guarantee you within 3 to 4 weeks of doing it in that way, near their maximum, they will feel some kind of pain associated to that.
The interesting thing about that is that there actually has been some pushback by various parts of the manual medicine, physical medicine, strength and conditioning, exercise science community around flexion due to some very isolated studies. But we know that we have a lifetime of work from obviously the GOAT, Dr. Stuart McGill, and you touched on it yourself, talking about the lumbar spine having to adapt to shear forces. And in a recent study that I've been doing with Dr. Aaron from Squat U, we've been actually looking at how those shear forces alter and change when the degree of flexion changes when you're bending about the lower back and not the hips. And we looked at a participant that lifted 100. So most of these studies that tell you that flexion's okay, they're looking at very isolated, low-power studies, and they're looking at people that aren't lifting a lot of weight. So they'll say, hey, you shouldn't lift. Like this study is on lifting, but then when you go in and you actually look past the abstract, what they're testing is someone lifting a pen or someone lifting 12 kgs. And so what me and Aaron wanted to do is we wanted to do like an in vivo type study. We were actually having someone under proper load. And so we had a participant sit in a static position at 45 degrees and at hip hinge under 150 kgs. So as far as the literature goes, this has never happened before. The reason why it hasn't happened is because you can't get ethical approval to have a bunch of people sitting under 150 kgs. We located a very successful, well-adapted powerlifter to do it for us, sat in that position, regardless of how strong this person was. That 150 kgs shredded his back, shredded it. We repeated the test. We had a 10-minute washout period, repeated it, and we loaded the hips, and we kept a relative lumbar spine. It's important to note that I said relative because you're going to have an element of flexing no matter what. that's what a lot of people say. Oh, you're flexing your spine no matter what when you lift. Yes, but you don't have to be an asshole about it. You can try and keep it relatively neutral. So when we taught when we said to the person, when you load the hips, we want you to hold a static hip hinge deadlift with 150 kgs a second time. But this time we want you to keep a relatively neutral spine, and we want you to load the musculature, we want you to load the hips, zero pain, zero discomfort. And manage to hold for exponentially longer. So it's that type of thing that people don't understand. And when you look a little bit more into the physiology, you understand that some of those muscles that sit down the back, down the lower part of the spine, iliocostus lumborum, thoracis lumborum pars, they attach to the sacrum and the ilium, and they actually come up and they attach to the pars on the lumbar spine. And they're in a position when you're neutral at about 20 to 45 degrees. So they sit about here. And what means is that as you're bending, they're in a leveraged position to hold the vertebra out of anterior shear. So as you're bending over, so you're bending like this, these muscles are sitting here holding resisting anterior shear so that you're not going to screw yourself up, right? The problem is the minute you flex your back, those muscles go down to a 10-degree angle. And so now we're looking at like, you're bending your back and you're coming down like this, and rather than being where they need to be like this, pulling the vertebra back, they're down here. So they're not doing any shear load anymore. They're down here. They're dealing with compressive load. Yeah. That's based on a 2000 McGill study. And when you really look into some of that's just one aspect of it, right? That's not even talk about like different types of loads on the disc and the way the disc is made up and fabric science and all this thing that McGill talks about. That's just kind of one thing. You can't have the average person coming in and loading them up with a massive amounts of weight. And like you said, I'm going to train. It's back day, right? So they pick up, they're excited, they load up the barbell, and they're thinking they're training their back. So they're bending their back. They don't understand, how to distribute the force through their body. They don't understand breathing and bracing. They don't understand how to load the hips. They don't understand how to bend, take some tension out of the bar or to contract the lats. To reduce the momentum or any of those types of forces distributing through the body. They don't understand that. And what happens is over time, we have this degradation of tissue, and then that's where you kind of end up running into tissue tolerance being exceeded by force over time. Or you have it in a moment where you have a massive amount of force and then you end up hurting yourself. Either way, what you said is very clear to understand that you want to try and avoid people doing the massive crane deadlifts. And then also, obviously, we've talked about it, the knee valgus thing. It blows my mind that we have people in the industry that are defending it. I was speaking to you about this last week, Stephen, and I was saying how I saw a meme, and it was saying how you can't have, you can't have knee valgus and be a world champion. And it was a picture of that two-time IPF winner. The female two-time IPF winner, I can't exactly remember her name, but she has like real mad valgus. And it's so interesting because people are like using this person as an example of why to have bad technique. It took me 2 Google clicks to figure out that she injured her hamstring leading into IPF Worlds and couldn't do what she wanted to do because she was in pain. It took me 2 clicks to figure out if I find a video of her on YouTube and her physio saying, yeah, she probably does need to fix that form if she wants to get stronger. So I remember we talked about it and you're like, oh, she probably has knee pain. And it's like, we don't, it's just so funny. People are like pointing to these people that don't really understand biomechanics. Okay, so we'll move on. So I want to talk to you, Luke, with your personal training. You've been training since you're 15. Obviously, you're a fit guy. You're strong. You're fast. You don't just do one thing. You're very efficient across the board. Why is recovery so important for you, and why is recovery important, for anyone that comes across the clinic? If you're treating them, understanding how they're managing their recovery if they're an athlete.
Yeah, the importance of recovery is massive, and it's like the candle wick will only stay alight for so long before it burns out. And unfortunately, you see too many of these young guns these days starting out on whatever they do, and they're not taking this seriously enough. And I've experienced it myself when I first started training. These guys out here are, just chasing the pump for 2 to 3 hours, probably running on a can of beer from the night before and a few slices of pizza. You know what I'm saying? So most people, like, the training is the easy and fun part, but where the work actually happens is outside of this. So, like, how are you preparing for your next session? How are you recovering post-session? What's your sleep schedule looking like throughout the week? Hydration, you know, are you constantly fueling your body with the right amount of macronutrients? So efficient carbs, proteins, fats, not just 1 day off and then 3 or 4 days off and then 1 day on. And for me, like, one of my biggest holes in my recovery that I had for a while, and man, you've actually had a chat about this, was the importance of, like, replenishing electrolytes intra-workout and especially post-workout. So for me, it's like, with the type of strength training, the higher volume and the larger conditioning pieces, as well as, you know, biking to and from the gym, I didn't actually realize how much sweat I was losing during my workouts. And so implementing this for me had, like, a huge impact on my recovery and my performance. And if I'm thinking back, like, a little story I have from probably when I was about 16 or 17, it was before I was heading off to university. I was actually working at a firewood company throughout the summer to, you know, earn some money for university. And where I'm from, Hawke's Bay, so on the east coast, it gets ridiculously hot in there in summer, up to, you know, 35 degrees. So I was waking up at about 4 a.m. each morning, heading off to the gym, you know, maybe 2 hours of heavy strength training and whatnot. Then I'd head off to this job at about 6:30. And it was extremely physically demanding. Like, we're lifting low firewood logs onto the splitter. It would be between, I'd say, 25 to 35 kilos. And you're doing that for, you know, 6-7 hours a day in the hot sun. Wow. And at this time, I wasn't taking recovery seriously. I probably should have slowed down a bit at the gym with this high intensity work. And it was about the 7th or 8th week into the job before I was just about to head off to uni. And I remember it being a scorching day. Bent down to pick up the log, and then one on top rolled off from the top and basically just wiped me out, cleaned me straight in the head. It was bleeding from just not stomach coming out. So I was like rushed to A&E, stitched up, and like, for me, that was a turning point really in my approach to being a young stupid-minded boy just wanting to lift heavy weights. That was a huge turning point for me in my recovery. So taking things a bit serious more now, listening to the body, recovering, eating well, replenishing, water, hydration, sleep, all that good stuff.
Yeah, it's funny when you're overtraining, it kind of creeps in, the side effects. And I know Bryn will know this as well firsthand. Like, when we're prepping for a powerlifting meet, those last few weeks, if you're not a little bit off, you're not training hard enough. Like, those last few weeks before your deload, you just, like, it's just little things. Like, you start walking into the doors and, like, stubbing your toe. Like, you're just doing dumb shit. And it's just, you're just not quite there. Like, because you're really, like, you've done 12 weeks of peak, or 6 or 12 or whatever weeks. And you've really built up that fatigue. And you're looking for that super compensation effect, right? So you're really towing the line. And it completely makes sense, if you're not sleeping and you don't have your hydration sorted or your electrolytes or whatever, that you wouldn't be at your best. And then down comes that log. Guts ball. Do you have a scar?
I've got a bit of one underneath the hair.
Talking about replenishing, it's interesting. You speak to people when, especially talking about some of those bro science people, or the typical bros at the gym, and they finish their workout and the first thing they do is water, protein, shake, and they're down in their protein because they're going to get it in within 60 minutes. I think there was one low-powered study in 2000s that said something about protein synthesis within half an hour or something of training. the interesting thing I always said to my clients was just think about what you're losing when you're training, right? If you think about what you're losing when you're training, that's what you need to replenish in order to maintain performance during the actual training session. And when I was in the peak of my squatting, I was training Aotearoa Strong. They had those corrugated iron roofs, and it was, you remember what that was like, Brandon, Aotearoa Strong. It was just kind of like a building. They had no AC. And I would be, my whole body was drenched. My t-shirt's just gone. Like, I'm just like, this is water, sweating. And I remember sometimes, I'm working up to like doubles at 360. And it takes a long time to get to that point. And so by the time you've done that, I'm talking, 4 or 5 hour sessions sometimes by the time you get to your accessories, and then, you're doing your proper warm-ups and your warm-downs. And I remember like for a while there, I wasn't actually doing any strategy around how to replenish glycogen, water, like electrolytes. And the minute I brought that into my training, I could do a full session and I actually felt okay. And it's funny, you look around the gym and you see these people slamming back the protein because they think that's the most important thing. Bryn, you've got a background in bodybuilding, right? What's your thoughts on that?
Yeah, so basically when it comes to training and when it comes to recovery, especially when it comes to the whole protein thing, you think about as we are training, what are we using as fuel? So it's glycogen, right? Because of the energy systems and the way that we're training, the intensity and the volume. So what makes the most sense is if you're burning that during your training, doesn't it make sense to have some form of glucose or related energy during and after? And of course, protein does make sense after, but during, it's kind of, if you're using glycogen as energy, wouldn't you want, I'm sure towards the end when you got close to your 400 kg squats, you were having some form of glucose at some point during your training, because in order to maintain that kind of workload and that duration and intensity, your blood sugar will drop off very quickly unless you have something on hand.
Exactly. Yeah, and I actually learned that early on before I even understood the science behind it. I learned that very early on through some of the GPC guys, Hamish. I'm trying to remember, early on there was a guy that was quite strong in the 110 category, and he was like pretty much at the top, like people couldn't beat him.
Was that Tom Mack?
Yeah, Mac. Yeah. Tom Mac.
I remember. Tom Mac.
Yeah, that's right. I remember now. You're friends with him. I remember him putting up an Instagram post, and I've told the guys at Chiro College about the story. And he's like classic white blow. He's like, nothing beats the white blow. And he's just got a can of sugar, and he's just that's his glucose replenishment. It's a glycogen replenishment. He's just doing sugar, bro, with water. I'm like, you got all these other guys, man, all these pretenders, they got their colored water, this and that. I thought that was hilarious. Like, it works. It's down the middle. It's efficient. It's cheap. Like, have at it, Like, that's classic powerlifter. Okay, anyway, we should move on. Interesting one. Dr. Stephen, Mr. Dr. Stephen, sir, could you give us some of your ways around how you build rapport with the clients and your patients? And then after that, I'll ask the other guys as well some of your strategies. Obviously, it's important, very, very important. For some of us, we have longer than others. For Luke, he's got like 15 hours. No, for Stephen, he's got 15 minutes if he's working on the weekends. Maybe even talk about that. But if you guys don't know, Dr. Stephen works in 2 places. So he's got a high volume place and not a low volume, but he's got a place where he can spend more time with people and a place where it's a little more fast paced. So it'd be cool if you could talk about that and how that changes your strategies to build rapport with patients. And how do you build rapport? How do you make them comfortable? I mean, you're about to freaking jump on their back and crack them into oblivion, especially knowing you and your CT adjustments. It's like boom. I think in the study I was doing, I just told you about, I literally put in it, I was like, the CT adjustment by MPI is known to be very effective, and many describe it as, and then I was like, quote, wow, quote, end quote. And this is like published research. So I thought you'd enjoy that one. There's mainly from one of the stories I've heard from you, blowing up people's CTs, just bam, Anyway, how do you build rapport?
Honestly, I just don't take myself very seriously. Now, what's going on with them, try to be as down to earth as possible. Most of the time, people go see a chiro, they're not usually the first person that they've gone to see for it to begin with anyways, so I'm just, hey, what's going on? Let's see if we can get you better. I never like promise to get them 100% better. I never strictly chase the pain. I'm always objectively measuring stuff pre and post any kind of intervention, just to constantly create buy-in and show that. And I always reassure them whenever I need their subjective feedback and like better, worse, no change. And if there's like a long pause and I know they're trying to think of some kind of an excuse, I'm like, don't lie to me. Tell me better, worse, no change, and we're going to change what we're doing to evoke better, worse, no change going forward.
And what's it like having to work in a place that's a little more fast paced?
I never provide less care or less quality care. I never change who I am, but it is very different when I'm expected to spend a max of 5 to 7 minutes with a patient, whereas the rest of the week I typically spend 15 minutes to 40 minutes with a patient. So it's a bit different, but you get very efficient.
I'm just I know when McGill started his clinic early in his career, he said, look, because McGill didn't have a clinical doctorate of any kind, right? He was a PhD, and they asked him in the University of Waterloo. They said, I want you to open a clinic, and he goes, I'm not a doctor, like I'm a PhD, I'm a researcher, I'm not going to help. He decided to do it, and he goes, okay, well, we're going to do it. We're going to give 2 hours. Well, I want 2 hours to do my history and to talk to the patient and to figure everything. And everyone said, oh, that's too long. Like, you get 15 minutes, you get 5 minutes, you get 20 minutes. That's the industry standard. And he goes, no, I want 2 hours. Anyway, a year after they opened the clinic, they changed that, right? You're like, oh, they changed that. They made it shorter. Of course, no. He put it up to 3 hours. And to this day, he will spend 3 hours with the patient before he moves into any type of treatment or any of diagnostic criteria. That completely blows my mind. Jumping over to you, Luke, you spend a little bit longer with patients. You've also got mentors creeping over your back shoulder, breathing into the back of your neck. How do you build rapport? How do you build rapport with your patients?
Yeah, it definitely starts from that first, like for us with our procedure, it starts from that first time you initially meet them. So that's obviously through, we get the 2 hour new patient appointment, which, like I said before, it covers that physical examination, history, all that good stuff. We know with the effective rapport, it improves the patient compliance with the treatment that you're providing, improves the clinical outcomes and patient satisfaction. So the first one for me big is like listening to your patient's needs and goals. And I think out there, that's all something we can do better. Unfortunately, there's too many like PTs, docs, chiros especially out there that are so self-minded that they have basically already decided on what they're going to provide based on what their own goals, values, and beliefs are, etc. But a few other things with the minimal clinical experience I've had so far, but displaying some kind of empathy towards the patient, being understanding of them, the ability to understand and share, their emotions, as well as cultural diversity. So you have to respect that every patient comes from a different background. They want different things. They have different beliefs and values around healthcare as well as treatment. So I think a few of those things are definitely huge when it comes to building rapport with the client.
Yeah. And what about you, Bryn? That's like in a more clinical setting. Obviously, yours is more in a gym setting with your clients. How do you go about building trust and rapport?
So one of the first things that I do is basically, because it's a personal training setting, one of the first steps is we have an initial consultation. So the client will come in, they'll be booked in with us, and we'll have to talk to them. So what I try and do within that first 30 minutes is build a very good relationship and pay attention to the needs that they say they have, and also get a very good understanding of what they're in the gym specifically for. So the difference between, say, for example, someone walking into a chiropractic clinic versus someone coming in to see me is the fact that a lot of people, when it comes to training, it's not necessarily they're coming to get strong or they're coming to look better. They have an underlying factor as to why they want to feel a certain way, if that makes sense. So what I look at is we really break down, okay, what do you want to feel and what do you want to get out of training? So a lot of people will say, okay, I want to get stronger. Why do you want to get stronger? I want to feel more confident. How is that going to affect you? And then we really break down the specific reason as to why they want to achieve a certain task. And then we attach emotion to their goal. So we have the rational brain, right? So rational thinking, but the emotional brain, or the way we think emotionally, is always going to overpower the rational side in terms of feelings. So the more feeling we attach with something, the better rapport you can build with someone, if that makes sense.
No, it makes a lot of sense. And it's actually I've heard a few really good coaches talk about that before, being able to actually, when you're engaging with your client, being able to communicate on that level, figure out what their goal is, but then looking past that initial goal into how are they wanting to feel, and then how can you bring that to the forefront, discuss it, and then move forward to help them get to that point. Because it's so important, because sometimes you can have people coming in, and if you're not communicating well with your patient or your client, sometimes you're not going to get they're not going to get the results that they thought they were going to get, and then you've got someone that's pissed off at you, and all you're trying to do is help them out. So it's like it's just like awkward thing. No, that's good answer. One interesting thing I wanted to talk about was why, and we'll start with you, Bryn. Why do you think building strength can help reduce the occurrence of injury or reduce injury in general?
So, well, my thoughts around that are basically, the stronger a structure is and the more efficient we can move, or the stronger we are, it'll allow us to move more efficiently. Understanding that there's two parts that contribute to that strength. So if we look at mobility, so the ability to move around a joint, because strength isn't only just having like static strength, for example. It's the ability to have the mobility and the stability to produce that strength. So as you know, if you can't shoot a cannon out of a canoe, to quote Andrew Locke. So it doesn't matter how strong we are, if we can't express that from a stable standpoint, it's kind of useless. So the more stable we are and the more mobile we are, the more efficient we're going to move. And the more efficient we move, the less risk of injury we have when it comes to producing a movement, because we're going to move in the way that is the best way possible and allows our body to move pain-free. And this is where technique kind of comes into play here.
And the cool thing about that is, it's not necessarily just important for athletes or for the general population. It's really important for every single person, rather than just pulling out, one type of athlete or one type of person. I know even when I was powerlifting, I would do my utmost to be able to be mobile, to be stable, and to be strong. But there were times where I'd get asked to do things. You might be able to relate to this, being like a powerlifter. Like if there's ever anyone in your like immediate family needs in terms of lifting, they're like, "Can you do it?" And I remember leading up to some of we all probably know Elliot Holtz, right? Massive strongman guy. He's a YouTuber, and he ruptured his bicep pulling out a root in the backyard for his dad. And so many injuries happen outside of the gym because we're moving in these planes that we're not comfortable in. And I remember I would be getting, I'm always the one to get asked, can you move the couch? Can you move the speaker? Can you move this? And I remember leading into competition, I got really like I got real straight with it. I was like, I'm not doing anything. Like, I've got a competition in 5 weeks, 6 weeks. I'm not doing anything because I don't want to risk it. And I'm one of the many people that can say that I flew very close to the sun and never got burned, in terms of never had a major injury, because I applied those principles that you just said. I maintained the mobility, right? I maintained that stability, and then I had the strength, but in a functional, in a functional way. Talking to function, Luke, what are your thoughts about that? I know you train multimodal in a sense, meaning you do a lot of stuff. I would say you're like a CrossFitter, but you're not like a CrossFitter. That's probably an insult. But you do, hand cleans and thrusts, and you do the squats, you do the bench, you do all the main stuff, but you also love to do kettlebell and stability work and all that type of stuff. So what is your thoughts about how training strength can help reduce the risk of injury?
Yeah, so like we've chatted across platforms, Instagram, most days about this. If we're looking at like each individual, right, they all have a different loading tolerance. So when it's exceeded, will cause pain and result in tissue damage over time. So in which this case, it can build up over time due to factors such as fatigue or, from the lack of recovery, etc. So, for example, if you're taking a highly trained athlete who has a much larger tolerance, they may benefit from something like a Superman exercise, versus taking a person with a lower tolerance who may find that the bird dog exercise is a more appropriate approach. So both individuals there are experiencing a similar stimulus, but are just beginning at different stages due to their tolerance, right? So this is where we're comparing an individual's capacity, which is the work that they can cumulatively build up to before they experience any type of pain. So I mean, building strength for the prevention of injury is huge, and one of the huge components we have is to stimulate tissue growth, muscular hypertrophy, increase bone density, as we talked about before, and improving, joint range of motion. So all of these, in which allows the body to adapt over time to increase that threshold in which the tissue can handle before it receives injury, basically.
Yeah, and it's looking at that tissue tolerance, right? So it can be something that's done over time, right? So like you can have your itis or your osis, tendinitis, tendinosis. You can have your things that happen that are more acute, right? So like some types of acute injuries. But really what we're looking at is that kind of that stimulus or that force, and looking at how that is overloading the tissues and how resistant they are to that. And one thing I had to figure out early on when I had a client who was in the US military was he was in the reserves and he was working his way up and wanted to be, do more military stuff. He was a young guy, and he said to me, I can't believe it. These packs I have to carry are like 20 kgs, and the guy was probably like 60 kgs soaking wet. And he's having to carry these packs, in training. And luckily he wasn't, he wasn't fully enlisted yet, and he wasn't actually, being deployed, but he was training to do so. And he reached out to me to get an edge above everyone around him because he needed it. And we worked on some really cool strategies, but we just got him strong as hell. And I just applied those strategies before we talked about mobility, strength, ensuring that, he's stable. But it's interesting because, the American government pay all this money to train Marines, for example, or Army personnel, and they have to make sure that these guys are resilient. But the rates of back pain are about 80% prevalence in the general population, the higher in the military, right? Much higher. So these soldiers, they look tough on the outside, but they're doing repetitive stresses every day on their body, and they're hobbling around like old men because they're hurting their back, and they're trying to figure out, how do we fix this? And I know you're probably a fan of Matt Wenning. He's worked with a lot of military, and his strategy is exactly the strategy that we're talking about. It's just building tissue tolerance, right? It's just getting them to do, he actually loves sumo deadlifts because of the way it engages the hip and reduces some of the pressure off the lower back. But it's really just looking at, hey, how can we increase their tolerance to the stimulus or to the stress that they're having, so that when they're out on the field, they can move about all these planes, right? Transverse and sagittal. They can move about these frontal planes without with a pack on their back, 15, 20 kg pack on their back, without injuring their body because they have enough strength built up to maintain without having to break that tissue tolerance. So I find strength truly is a type of medicine, and pushing that idea out there is so important. So I definitely wanted to touch on that. Okay, real quick, we will move on to why do you think, Bryn, why is it important for you as a coach to practice evidence-based or evidence-informed? Why is it important for you to understand and keep up with the latest research?
If we basically look at that, it's one of those things, Brogan, where the more I do it as a professional, it allows me to understand what points of information are useful and not useful. And it's also allows me to understand what my clients could possibly be going through mentally as well as physically as they're performing a movement. And when we look at that and when we really speak to that, it allows me to coach them at specific points, knowing what they would need because of the fact that I have performed that or I have experienced it and I've used that based off evidence. So if we look at research, the research basically tells us what works and what doesn't work to a degree, right? Based on research and based on studies. So my job as a coach is to look at that research, apply that research, and see what works and what doesn't work specifically for myself and my clients based off the study. So a research paper isn't 100% going to tell me, okay, this is exactly what you have to do, but it will tell me based on the trial, these are the findings, these are the applicable facts, this might work, but then when I apply it, I might alter it based on what I find useful and not useful, if that makes sense.
Yeah, and personal experience and what you've learned over the years, not just with your interactions with your patients and your clients, I should say, but also how you felt when you put yourself under a bar. Yeah. In the Lower Back Disorders book I'm rereading by Stuart McGill, I'm rereading the original one, so I'm not reading the one that's been changed over the years. I'm reading the one that first came out circa 1990s or something, and he specifically talks around some of those concepts of having to actually understand what it feels like to be under load, or understanding what it feels like to have, debilitating pain, and how that really does change how you treat people that come across your table or come across your gym when you've actually been able to experience it. And that's one of the leading reasons why you're a doctor, right, Stephen? Because you've got your unstable spondies. So do you want to speak a little bit about that?
Yeah, I do feel like I have a pretty large advantage having gone through some pretty significant pain. With my spondy, I unfortunately have a pretty long history of severe and chronic pain, so I'm able to empathize with my patients a lot more than other clinicians may be able to. And a lot of times I don't even bring it up on the first visit because I don't want to make their visit about me. Their visit is very much about them. But usually they all find out some way that I also have gone through some pretty traumatic pain, and they definitely look at me and listen to me a little bit different whenever that does get brought up. And they do understand that I'm 100% focused on helping them get out of pain as much as I can. I did mention earlier I don't chase pain, and I still don't, but I acknowledge their pain, validate their pain, and try to help them experience as least amount of pain as possible.
Do you validate their parking?
I do not. That is too expensive.
Just your pain there. Yes. Fantastic. Bryn, tell me, man, why is it important that your knees don't shift all the way in when you squat?
Well, I can tell you firsthand that when there's any deviation and movement of the knee, it affects the ability to produce force coming up. So what that means is if the joints aren't fully stacked, so in this case, if the knees are coming in, that's a lot of shear force compressing into the spine down straight into the knee. So it's not really an efficient movement to be able to complete it. And it's also a high risk of injury at the knee, because that's a lot of, so if we think about it, we're pressing up from the ground into the knee, and we have compressive force on our backs going down into the knee from both ends. And depending on, so you alluded to before with the lumbar example, and I know you and I have spoken about this before, there's a difference between a slight deviation and a very obvious caving of the knee. So I can use myself as an example. So leading into this prep, I had issues with my right knee because I had tendinopathy, and my right glute was having a hard time at rotating the hip out. So what I found is as I was getting closer to my maxes, my right knee would cave in, right? So as it would cave in and I was pressing up, I was getting a shooting pain at the top of my patella. So that was telling me something within my body isn't allowing me to rotate my knee out, which is causing a lot of that pain and the shear force to be produced on that knee. So if we look at the IPF example before too, like, yeah, someone might be able to get away with it once, but then when you look at the whole picture, what's the person like after they have completed a maximal squat with a knee valgus? Let's look at their pain levels. Let's look at the movement. Let's look at possible tears in muscles and things like that, right? So it's just because we see it on TV and one person does it, who is an outlier who could possibly get away with it once, does not mean that everyone can do it, right?
Yeah, and it's putting not just the active structures in compromised positions, but also the passive structures, like you're talking about ligaments, your tendons, your menisci, and it's changing the vectors of force and how that is being distributed through your body. If your knees are coming in, they're likely also going back, meaning now you've created a moment arm on the lumbar spine, and like you said, rather than
that's
sitting
one of the
down and
things
having
that I
compressive.
wanted to mention too, Brogan, is when we see a lot of knee valgus, what you'll also see due to that is like a good morning type squat too, right? So the knees will come in, which don't allow the quads or the lower body to actually produce force because the knees are in, which ends up in the lumbar spine taking the load and having to good morning or hinge the weight up. So you're looking at two things. You're looking at either a knee injury or a back injury as a result of that leak in force.
It's like centralized or peripheral. Either way, the force is going to be put into structures that is not ideal. And exactly like you said, we're changing the amount of force, the vector of the force. We know the spine, lumbar, especially the lumbar spine, doesn't do well with shear force, and you're specifically putting yourself in that position. And then there's people on the internet supporting that and saying, "Oh, look at this person, she's amazing." It's like constantly putting yourself in that position. We know, stimulus over time, based on someone's tissue tolerance, exceeding tissue tolerance is going to be injury. Yeah, you might not hurt yourself now, but you will in the future. But even in this situation, she did hurt her hamstring leading into Worlds, and then that hindered her performance. So it's like, it's interesting. Is there a correlation between her technique and her hamstring? Maybe, maybe not. I mean, I know the hamstrings, don't particularly move a lot in the squat, but like there's a lot going on in terms of force distribution still. And if you're aware of Lombard's paradox in terms of how you distribute the force between the hip and the knee and the quads and the hamstrings, there is a lot of force running through those structures. So that's an interesting thing. Talking about, and I mentioned in my TikTok about provocative testing. What provocative tests do we do clinically, Luke, that would mimic valgus, and what's the point of it? To put you on the spot.
So would have a lot of valgus and varus ones as well, orthopedic tests that we're applying at the knee. But also if we're looking outside, like we know that the pain is not always where it's coming from at the problem. So looking above, like Bryn was saying before, at the hip, but also looking down at ankle mobility in particular. That's like one of the hugest things I've found with working with my girlfriend in particular, getting her back into the strength and training exercise with the help of Brogan, but also myself as well. And Aaron from Squat University, he also talks a lot about that in his book Rebuilding Milo, is the mobility work that needs to be done down at the ankle in order to and improve those efficient movements throughout, so we don't get that type of valgus occurring anyway. So yeah, orthopedic testing down at the ankle as well, looking at the shift, the movement of the talus relative to the fib, that joint in particular.
Yeah, how the tibia is rotating, and then also obviously even just like being bipedal and just heel striking, and this is an MPI thing, Stephen, taught to look at the eversion, taught to look at pronation of the foot, and the eversion, the talus is moving on the tib, because it's like, if that's locked up and you're a sprinter, for example, that's probably going to be causing issues upstream. I know that's something that Corey Campbell teaches, and something the MBI guys, that's part of their functional assessment. As they're zooming through the body, they'll always check eversion. Is that something you check as well?
I do.
And do you adjust it often?
I do. I tend to adjust. There's almost always some sort of dysfunction in the feet movement-wise, so the feet get a lot of love from me. I'm not a foot guy, but the feet get a lot of love from me.
It's funny because in our experience at NZCC, very little focuses on the foot.
Yeah, at that high volume place who had a meniscus tear, they were waiting surgery, and I was like, we're gonna adjust that foot, and they were like, you're gonna do what? And I was like, we're gonna adjust that foot. They're like, you can't touch that leg. And I was like, yes, we can. And I adjusted his talus, and he got up, and he was like, oh wow, like obviously my knee still hurts, but I feel way more stable.
Was it medial meniscus?
I honestly don't remember. This was like a month ago.
Yeah, but it's just funny how the force just goes up to the next joint. Like if you're not able to evert and you're not able to pronate and distribute force through the foot, that's just going to jump up to the medial meniscus, and people are going to have knee problems. And then if the knee's not functioning, it's going to jump to the hip, and then you've got your fascia slings, your fascia lines running up through to the shoulders. Like it's really just one big connection, and if you can biomechanically sit back and watch someone. I know, looking at Dr. Locke's his seminar paper, he ended up using some of my illustrations, and so he sent it through for me to have a read, and he talks a lot about that. When he's assessing people, he just talks about how he assesses people, and a lot of it's just like get them to squat, get them to do basic movements, just to bend over. If you've got a trained eye, you getting someone to squat and to hip hinge and to do an overhead press, or or just move their shoulder or whatever, like you can pick up so much from that, And then you've got all these like people that don't understand biomechanics doing all these different types of things. Now, don't get me wrong, there are other things you can do. It's not just getting someone to do basic movements, but you can get a lot of information out of the basics. A lot of information. Do you often get people to squat, Stephen?
Yeah. I load the joint. I see how they're moving. I want to know how they're moving before I do much of anything, because that's how I'm going to base our treatment and our goals based off of what their goals are and how they can or cannot move.
I love that, though, in a pure clinical setting, not in the gym at all, and you're using those movements. I know last week you talked about educating your patient on what it's like to brace at the core, or I think it was move the hips or something around those lines. It's like being able to teach someone how to use their hips, how to hip hinge, or how to squat is very, very valuable. Moving on from that, what do you think are the most fundamental movements that a human should do day in, day out? And I'll throw this one to you, Bryn.
So if we look at it, it's basically any sound program should be based around the following. So it should be based around a squat, a deadlift or a hinge, some form of unilateral movement of the lower body. So you can either have a lunge or a Bulgarian split squat or a split squat, and some form of rotation, so rotational exercise. And like it's, when we look at it, a lot of the programs that a lot of personal trainers write, they write them based on muscles versus movements. This is why I was alluding to before, the importance of understanding movement is to go, okay, if we understand the fact that what are the basic tenets of human movement that anyone should be able to do, anyone should be able to squat, anyone should be able to lunge, perform a hinge movement, rotate, press over their head, press horizontally, and pull in those lines of movement. So it's pretty much like everything that I said, but also understanding and having principles around movement and programming. So what I can build on in terms of that is the way I program, as I program in a way that allows people to, so we basically, in terms of the programming, the clients that I'll get them to mobilize, right? Because a lot of people, they need to have mobility around a joint, like I said before, in order to stabilize and produce strength. So we mobilize and then we'll activate it. So it's kind of like you do some static holds or some kind of activity to warm the muscle up. Then we'll do some stability exercises. Then you'll head into touching a bar, as an example.
Oh, so just moving on from that, because we're running out of time and we could talk about this stuff all day long. It's so interesting. So Luke, how do you think chiropractic specifically can help athletes?
Yeah, well, if you look at some of the research, like the likes of Heidi Harvick in the chiropractic profession that you've mentioned throughout your thesis. So some of the stuff she's looked at is spinal manipulation into a fixed joint and the impact on neuroplasticity first off. So essentially the brain's ability to change or rewire itself due to the external and internal environmental factors. And we know that with the pain, like it's much more complicated to the point that the side of pain is not always where the problem is. So in fact, so it's like extremely influenced by how our brain perceives and interprets its surroundings, in which in return the brain can undergo maladaptive or negative changes. So if you're considering all of this with an athlete, the spinal manipulation or adjustment can have a massive positive benefit on the neurological modulation effects, how the brain specifically perceives the information around it, such as body awareness, visual and auditory information. And then, like the likes you mentioned before about spinal manipulation on the impacts of feed-forward activation, which is extremely beneficial for everyone, just athletes, but really we're looking at like it's essentially a pre-planned action by the central nervous system in order to prevent injury or harm to the body, which has been linked to the lower back pain stuff that you mentioned as well. So the likes of your abdominal muscles that are responsible for stabilizing your body before you move a limb need to be switched on. So if you think about certain movements in different sports and strength training, this could definitely help, athletes getting that extra 1%. As well as a huge bit of research from Heidi. She loves the prefrontal cortex, as we're well aware of. So that's the area of the brain that is really responsible for our higher cognitive abilities, such as regulating, emotions, moods, thoughts, and decision making. And her studies, there was a 2016 study, I think, that showed that spinal manipulation can impact the sensory motor integration of the prefrontal cortex, which is basically the ability of the brain to process the sensory information that it receives and adapts the motor commands accordingly. So like, performing a squat or deadlift or running a marathon kind of thing. where it can definitely help out.
Yeah, and it's interesting because we know stress acts on the body, and we know it impacts the HPA axis, which impacts cortisol and the release of cortisol. We know cortisol is a modulation hormone when it comes to pain, and also the perception and distribution of stress throughout the body, like biologically. And it's interesting because how the hypothalamus kind of interacts. There's like the studies talking about the multimodal integration and how it impacts the prefrontal cortex. We need more research to be conclusive of it, but it's having that information is really interesting, especially as a chiro, being able to say that to an athlete. Like, hey, we know it modulates pain, but we also know it helps with proprioception and balance and performance, and it's possibly even going to help you regulate emotions and mood and all this different type of stuff. Although it's short term, what is long term? Well, rehab, movement, strength training. That's where we off ramp, and that's where we pipeline into the strength coach. So it's like, man, our profession, strength coaches, obviously I've been a strength coach for a long time, and moving into the clinician world, those two things really do go hand in hand. It's so important. We'll move on to Bryn, 2 questions in one. Number 1, why do you succeed where most coaches fail? And number 2, how does being an athlete change your approach as a coach? I'm assuming they probably are connected.
Okay, so I guess I succeed in the way that kind of the second question flows into the first one. So having been competitive from a young age and having also been competitive in powerlifting and still competitive, it allows me to understand not only how to move properly, but also what people may go through in terms of pain or injury prevention and things like that. So my programming has evolved a lot over the years based on my experiences as an athlete. So the more knowledge that I've accumulated from my own experiences, it's made me sit down and it's made me reflect on my own training and seek out and talk to people like yourself and Gawain. And I've got a friend in Melbourne, Zoran, who... Zoran Yankovsky. So he's a remedial massage therapist. So I've spent a lot of time talking to these people, and it basically makes me refine my process for my own training. So when I refine my process for my own training and apply it to myself, I feel like there's a lot more credibility in that when it comes to training or taking your clients through something. And that's also, I guess, one of the things where I succeed compared to others, in the way that when you can think critically on this level for a long period of time, it allows you to see things that a lot of people don't see because they don't have the same lens that they look for within when it comes to training. So an example could be, I had a client recently who came to me from a different trainer, and she was saying, oh yeah, like he said my squat form's all good, but when I perform my squat, I get a bit of back pain. So I had a look at her squat, and what was basically happening was, as she was hitting the hole, her hips were shifting up, right? So when I looked at that, I said, okay, what I want you to do is focus on springing the floor with your feet a bit more, really opening the hips up and sitting down into the hole and driving your back into the bar while having your shoulder blades in your back pockets. So I changed a few of the subtle cues that I know work for most people, and zero back pain, lower body was fully loaded, and a textbook squat based on her mechanics, right? So when we do talk about that, it's, as an athlete, when you perform it for such a long period of time, you start to understand the different cues and the different fundamental movement patterns of how someone should move, not only yourself. Because when you and I have competed, how many different body types are there at a competition? And you look at the amount of weights lifted at such a high level, with all of us moving uniquely according to how we move. So yeah, that's where I believe that it really sets me apart from the other people, in the fact that, especially here in Christchurch, like, I call myself a strength and conditioning coach, but I feel like I have earned that title through under the bar and experience abroad and really having a thorough understanding of the human body.
Yeah. Yeah, more than just what other people do, getting a certificate out of the bottom of a cereal bag.
Yeah, and that's one of the things, like, you know, within this industry, it's so important that when people say, "Oh yeah, I've got a S&C program or I got a strength and conditioning program," it's actually, no, you got a personal training program from a personal trainer.
Yeah,
and it's kind of, I'm sure you've seen it too, Stephen, where doing a 6-week manipulation course doesn't qualify you to practice manipulations on someone. It gives you a very, very basic understanding of how to do it, but does it necessarily mean that you're qualified or should be doing it? Probably not.
Yeah, there's a mirroring effect that happens between the industries, and as soon as I start talking about it, both of you guys will all know about it, because what Bryn's saying is, hey, there's so many people out there calling themselves a strength and conditioning coach, and really they haven't paid their dues. Really, they don't understand biomechanics, physiology. Really, they haven't put themselves under a bar. Really, they just don't have the experience, right? It's funny because in the chiropractic world, every second person wants to be a sports chiro, and you've got these people that put on these events, like a 2-day event, and you'll go along and you'll learn how to tape someone's ankle, and they'll give you a little piece of paper and you'll be like, oh, I'm a sports chiro now, but give yourself a pat on the back. And because of the old dogmatic, philosophical, incorrect model that's been taught in chiropractic, these chiropractors, they literally think they're gods. They think they're neurosurgeons. They think they're literally removing interference in the nervous system, making people better forever. And they literally think to themselves, oh, as long as I'm removing the interference and I'm dealing with athletes, I'm a sports chiro. And it's like, no. Don't call yourself a sports chiro unless you understand biomechanics, physiology, applied physiology, and biomechanics, and you understand how to move in, and you actually understand how to look at a patient and rehab that patient from, you know, really bad position to back to full time. And it's funny because I had a client choose, and they went to the osteo, crack, got some x-rays, you have arthritis, used all these big terms to scare the person. And they came to me. I said, look, let's just regress you back and work on some movement patterns. We fixed the hip. We went through, I did a McGill type history. We fixed the hip. We figured out getting it out of the car was an issue. We figured out that vacuum cleaning was an issue. I found out that she was doing flexion exercises as soon as she woke up, right? Because clinicians told her to do so, which is not a good thing to do if you've got back pain or hip issues. So remove some of the things that were provocative, and then we worked with some strength, we progressed. And then a few years later, same person had knee problems, same thing, progressed. But they had all these labels coming at them from these people saying, you've got osteoporosis, or you've got this, you've got that. But you really have to understand physiology. You really have to understand how to take someone from where they're at, and knowing, based on watching them and having the experience yourself, to know how to give them those steps and also encourage them along the way. And doing a weekend course on how to tape an ankle, it's not enough to call yourself a sports physio, just like it's not enough to do a 6-week online course in strength and conditioning and call yourself a strength and conditioning coach. It's just like, it's not enough. And I get so frustrated because we're here trying to like elevate good information, and the very people that don't put in the work are the ones that are perpetuating the bullshit online. It's the same people, man. It's the IPF lifters and sports chiros and pain science crew, and we're coming up against some of this bad information. And I always say to Stephen, I don't want my platform to be negative, but it comes to a point where you have to actually address some of the more negative claims out there, and so you can actually elevate good stuff. We have 10 minutes. So, so I want to kind of ask all you guys this, but we'll start with Stephen. Where do you think we have it in terms of strength and exercise, and for you as a clinician, that looks like rehab, all that stuff, right? Where do you think modern medicine has it right, and where do you think modern medicine has it wrong in terms of those protocols? Because I know a lot of the people writing the protocols in terms of like the actual guidelines are pencil necks that have no idea how. They're not lifters themselves. They don't have experience themselves. A lot of them are going off pain science influence. So, like for you, do you feel like modern medicine has it right? And if so, why? Or do you feel like they need to get better? And if so, why?
I would not say that modern medicine has it right, because at the end of the day, most people don't have any true experience in the world of exercise or even physical activity, when I meet any new patient that is a college student and they're like pre-health, they're always like a bio undergrad, and I'm like, no, go do exercise science, go do public health, actually learn about the human body before you go become a clinician dealing with the human body. There's such a big disconnect between what happens in healthcare and what needs to happen for someone to stay healthy or get healthy or be more active. And it's a massive disconnect.
Yeah, massive. And what do you think about that, Luke?
Yeah, it was like we were chatting the other day, and you introduced me to the neurosurgeon by the name of Dr. David. Yeah, like you said, he started up a college based around functional movement, and to me, that's mind blowing. Like I never would have thought, someone so high up on the medical hierarchy would be invested in focusing on how people basically move and function. And I dived a bit deeper into his Instagram page, the NeuroHab movement therapy page. And I came across one of the posts actually, and it was something about like they had a list of names of doctors or professors on the clinical care standards, and I think across nine professors or doctors, they had over 30 different positions they held, but not one of them specialized in strength training, exercise, rehab, anything. And like to me, being on the committee for low back pain, it's like, how many of them would you think would be able to, perform a deadlift correctly, squat under a bar, have the kettlebell mastered, focusing on active floor stabilization, bracing the core, engaging the lats, all of that stuff, incorporating resistance training for their clients. And, to me, it's where the medical system has gone slightly wrong, but we need people like that changing the ways.
Yeah, and that the college you're talking about, the College of Functional Movement clinicians, is on Instagram for those that want to check it out under NeuroHab Functional Movement Therapy. And it is amazing because when Dr. David introduces himself, he will often be like, I am a coach first, neurosurgeon is last. And after a whole lifetime of cutting into people, he's started this college because he's wanting to now kind of push this new narrative that he wants to get to people earlier, and how do we get to them earlier? We push functional movement medicine, and we push it early so that, we're not seeing so many people needing to be cut open in their older years. He's really, really incredible, and it's cool to see someone that is so educated pushing that type of narrative. And obviously Dr. Locke is involved with him, and Dr. Aaron is involved, and so same with me. But yeah, his name's Dr. David Johnson, so close.
All right.
Yeah, Dr. David Johnson, brain and spinal neurosurgeon. So I'm just going through his stuff here. Dr. Johnson's expertise cover a wide range of brain and spinal neurosurgery. Pretty cool. And he does a lot of awesome stuff. And if you go onto his page, there's videos of him squatting, overhead pressing, just getting it done, man. I was messaging him on Instagram. I'm like, I was seeing some videos of you like squatting and stuff. I'm like, you're a beast. He's like, I'm a 50-year-old neurosurgeon, but thanks for that. I was like, all right, props. Okay, sweet. We'll finish it up there. It's been a really awesome podcast. Obviously, thank you to both you guys, Bryn and Luke, for coming on. And we'll definitely have you on again in the future. There's so much to talk about. There's so much good information to elevate. And there's so much bullcrap to discuss as well. So that's kind of the goal of this podcast. Is kind of our mission, if you will, is to try and elevate that good information, and having you two guys on has definitely helped us do that. So much experience from you, Bryn, hearing you talk about stuff, really awesome, so much intelligence, and so it's really cool to see what's happening for you over the next few decades, especially throughout Aotearoa and throughout the whole world. Me and Bryn have some things planned in the future. Hopefully we can execute and do together throughout New Zealand. Yeah, watch the space. That would be epic. And obviously thanks to you, Luke. Big things for you, man. Looking forward to you graduating and taking I'd say chiropractic world, but we know it's going to be all of the manual medicine world, because you're going to be one of those chiropractors that represents the profession in the best way. And throughout the world, in America, they have MPI. In New Zealand, we don't have anything like that. There's really no one doing that. There's a wide open space for someone to come through and dominate that area. And so I know that's going to be you, because you're, like I said before, you're incredibly talented critical thinker, and that's what we need. We need people at the top that know how to critically think. We need people at the top that understand physiology, biomechanics, and for God damn, they know how to get under a barbell. Anyway, thank you guys. I really appreciate your time. You're absolute legends. We'll have you on again. Have a fantastic rest of your day. It is nearly 1 o'clock in New Zealand, but for poor Stephen, what's the time for you?
It's right at 9 o'clock.
Oh, it's not too bad, not too bad. I thought it would be like, I was like midnight or something. The podcast will probably drop at the end of the week, but there's going to be some absolute gold from you guys. You're legends. I had so much fun talking to you. I'm going to be buzzing for the rest of the day, so I really appreciate it. Shot, guys. Peace. Have a good one.
Bye.